care in our acute care setting, and which family center care, which is greatly impacted by the pandemic, but it seems we are resume them slowly but steadily. This is how we doing in Taipei so far. Yeah, so I'm looking forward to learning some experience from our friends in Indonesia as well. Thank you.
Yeah, thank you. I think for the pandemic situation, the regulation is similar with us here in Indonesia during the COVID-19. No visitors allowed to visit patients. Yeah. So for the parents who stay with children, they must repeated tests every week to make sure that they're free from this COVID, something like that. Especially for acute care, children with acute care, the government make a limitation to children to hospitalize. Yeah, they better take care in their home. However, right now, after pandemic, the condition is back to normal. Yeah, no need to test COVID again. And some visitors, limited visitors, allowed to visit children as well as parents. Please, Ibu Nur Hayati is the Vice President of IPNA. In Indonesia, we still wearing masks in public facilities as well as in hospital. So you see some colleagues here using masks because they still working in their hospital.
Yeah. The similar masking policy is still active in Taiwan, although the social distancing policy is much relaxed. I mean, after the April, right? But the mask procedure is still implementing strictly inside the hospital. The same thing in Indonesia. Yeah. Since we know that although the major outbreak seems subside, but still there exists a new variant of the virus. So to protection the family or the children, so the physician and all the healthcare workers in the hospital, they still strictly need to do the masking. Yes, the same thing.
Yeah.
So it's the same thing that we try to some effort, example in our hospital too, because the children cannot see well about the expression of the nurses, right? And also the physician. So they try to do something to help the children get familiar with the nurses and the physician, and without the fear with why we put the mask on. Yeah.
Okay. Yeah. I invite some comment from friends. Anna, Purita.
I will want to ask to Professor Shu Yu Kuo. What is the standard of child nursing care in Taiwan, Prof?
Standard of nursing care for pediatric.
For pediatric, yes.
Standard of pediatric care in Taiwan. Suaranya bising ya?
Hello, I'm sorry for the technical problem, okay? Can I have the experience sharing again? So we are sharing.
Yeah, Rita asking about the standard of pediatric nursing care.
Oh, standards of the pediatric nursing care in Taipei. Standard. Okay, I think we follow the national guideline of the pediatric care nursing, and I think that family center care is the value they will be follow. I mean the family of the caregiver of the pediatric patient is so important. So we try our effort to explain all the procedure to our patient and also to the family in advance and make sure they know all the procedure very well and to make a shared decision together with the physician and with the nurses. So this is the procedure, the communication procedure that we value in Taipei. In terms of the physical care, a similar thing. I think you used to, in acute care, we have the physician and we have nurse practitioner and also registered nurse who will taking care of our patients in terms of physical need and psychological need. And if we have some family, they are in a social disadvantage family, we do refer them to the social service to get additional support for our patients. And recently, increasing the immigrant family in Taipei. And so we do provide the translation service because this is so important. And they don't know quite well about the procedure of the admission, treatment, and so on. So to take into consideration of a cultural perspective is quite important as well in our pediatric nursing care in Taipei. And of course, we have mentioned the precaution of the universal precaution of the infection protection. Those policy is still being very active and need to be followed. And also we have some experience learned during the pandemic. So we have using several online channel to maintain the communication with our family. We reduce because right now we can do the in-person visit and in-person education. So we reduce the frequency of online contact. But we do see that the value of using some online methods to improve the parents understanding the care procedure of their family. So in Taipei Medical University, we do provide a lot of QR code. So the patient family, after they receive the instruction from our nurses, they still can using their smartphone and to access to the online resources of the patient education afterward, and then come up with the question to discuss with the caregiver, I mean the health professional if they need it. And the other thing, the standard of pediatric care is we emphasize on the discharge planning. So we need to prepare our children and their family in advance since the day one when they are admitted to the hospital. So we activating the discharge preparation, ensure they do have a good understanding and they ensure they do know how to taking care of their children after the discharge. So we have certain standards to be followed, and during the nursing care, pediatric nursing care, we do have a team to do the quality assurance to monitor whether we meet the criteria, meet the standard of a quality of pediatric care during the acute care setting. And in addition to acute care setting, I think the standard of pediatric care is so important to highlight the health promotion, which include the immunization and also the physical checkup, and to make sure the children, the growth and development is meet the expecting path. So we will monitor them to have a regular checkup. So for the in Taiwan, we have national health insurance coverage. So every infant or every children, they get a booklet. We call this, it's a children booklet. So in the booklet, we do mark in what age, 3 months, 6 months, 1 year, or 1.5 years, the schedule of the vaccination, and also put down the record of their body weight and height and related health observation in a book. So every time when the parents bring their children, maybe go to the community clinic or go to the hospital for their physical checkup, every health professional can follow the chart to see the compliance rate of the vaccination. And if they notice there are something did not follow, maybe because of illness or because of any factors, then they will actively to help them to remove the obstacle and to meet the standard of the guideline of the health promotion for our pediatric patients. Yes. And in addition to health promotion and also the acute care, we do have some standard for the rehabilitation service as well. And those are the special care service for those children who really require the early intervention, help them to not to delaying their developmental task. So these need to be referral, can be referral from the physician or from the other health professional to these rehabilitation service. So we call the early rehabilitation to reduce the disability of the children and helping their family as well. Yes, thank you.
Yeah, thank you very much for the explanation. And Rita?
Yes, Morgan, it's enough, very comprehensive explain. Thank you, Professor.
Yeah. Do you hear?
Alen.
Is it too loud? Can I open up the volume? Oh, okay.
Prof apa ya? Prof Su ya?
Prof Shu Yu, ya.
Prof Su Yu.
It's okay.
Saya mau nanya dong Bu Alen.
Iya, boleh.
Iya. Dia kayaknya lagi ngomong ya.
Ngomong itu soal
Betul.
yeah. Another questions from Nurse Nur Hayati.
Ya. Terima kasih Bu Alen.
Bentar, lagi pakai headset. Clear? Yeah. Yeah, you can hear clearly.
Yes, thank you. Please, I'm so sorry for the technology problem. Okay, please, go.
Ya, thank you. Salam kenal apa ya? Salam kenal ngomongnya. Prof Shu Yu, I want to ask about now the condition after having pandemic, we having endemic situation.
Mau dicek nama-nama ini loh.
I want to ask about
Mau dicek, mau dicek.
apa ya? design of the
Kalau ini masih jelas nih.
nursing room ya. And
Itu gede banget.
how about there is any special tools for the and design and special design child nursing room after pandemic room.
Gak cuma
Because
50, aku udah pernah ngurusin anak.
different situation about the room and about the tools in Bu Alen alat pelindung diri itu loh, the tools to protection infection. This what do you think about that?
Okay. Yeah. Thank you so much. Thank you for your questions. Let me just clarify one more time. You said the tool that we use for the spatial protection for the.
Now in hospital we have to use the mask like this.
Yes.
When I think this is the rule of the hospital. How
Yes.
about
The same thing. The same thing. I mean, the same thing in Taipei. Although people, when they go outside of the hospital, they can feel free to take off the mask, right? They can do the exercise without the masking. But for the patient, for the health care professional, they do need to strictly to wearing the mask during the acute care setting. So the mask policy still activate. And also for some of the children, when they get admitted to, okay, for those children with the symptom, then we need to get testing. If the children without symptom, we don't actively to do the routine checking, like COVID test routinely. And once we notice the patient is positive and also with symptom, then we will put them in an isolating bed or isolating unit, but not for the whole duration, maybe for 3 to 5 days. When we look at their symptom is being relieved, the isolation policy can be relaxed. So we really try that to maintain the infection control policy. At the same time, still encourage the family-centered care. It means that we need to have a good communication and decrease the anxiety and the fearful of the hospital experience for our children. Since when they got admitted to the hospital, they all see the patient wearing the mask. I think that way will be very scary for for our young patients. So we try to do some efforts to reduce their anxiety about the masking. And also we encourage it. We have do some classes for our nurses as well in terms of how to improving their communication skill with the mask on. And that way can help them to building a rapport relationship with our young children promptly. So this is how we coping with the COVID-19 post-pandemic in terms of the period intervention right now on July. And as we know that the intervention keep changing. We have the Center of Disease Control. Maybe after the certain month, maybe 1 month, 2 months later, they will change their policy again. Yes. When they have a new understanding with the virus, maybe the policy will change again. And so we always follow the guideline from our center, CDC in Taiwan. Yeah. Yes. Thank you so much.
Thank you, Professor. Terima kasih, Bu Alen.
Nurhayati works in a children's hospital in Jakarta. And another questions? Pak Heri from Bali. Do you want to share the children's care in Bali?
Izin boleh.
Oh yeah, Yani from Bandung.
Okay.
Yeah.
Hey,
Hi.
hi, Prof. Shu.
Hi. How are you?
Thank you. I will ask to you about level competency in pediatric nurses in Taiwan. How to set the competency level of pediatric nurses in Taiwan after a pandemic in ordinary rooms and isolation rooms, and how to calculate to overload working for the pediatric nurses in there. Thank you.
Okay. Thank you so much for your questions. Let me make sure I understand the question correctly. The first question is regarding the competency of
Yes.
the pediatric nurse.
Y-
Yeah.
Yes.
Okay. Competency of okay. In Taipei, we have a competency ladders for our pediatric nurse to follow. So we have the ladder from we call N1 to N4. Okay, so we have different classes for different level of the nurses, and those core in-service courses remain the similar structures, but the content was incorporating the new evidence in terms of the pandemic and also in terms of new outbreak that we've been learned in the past 3 years. So every nurse in different later of the nursing career, for example, first year of nurse, they need to complete the certain hours of clinical care and also need to write up a case report, a study, a short report of evidence base. So anyway, we have different perspective of the competency for the different years of nurse to be achieved. Okay, and thank you for your question. Is right now I want to emphasize right now after the pandemic we have we try to dealing with a very specific challenge is the shortage of the health professional. I'm not quite sure. Do you face the similar situation in your city? Since during the pandemic, so many nurses they get exhausted, right? And so many nurses maybe they choose they need to take a break during after the pandemic, right? So they choose to have some different arrangement on their career. And also for our new nurses, they just graduating from the school, right? The newcomer is so important. However, during the past 3 years, for the new nurses, I think they have their clinical experience is being affected by post pandemic, right? They couldn't. We have so many online learning as we do here, right? The student need to learn nursing knowledge, learn the nursing experience using some online methods. So for this specific new student, graduating student, and in the hospital, we offer a special program for the new nurses, especially they have received their nursing education during the past 3 years, okay? And then we offer them with an intensive program and give them a simulation in education to do some practice on the skill and link them to the clinical experience. So in order to help them to have more confidence in taking care of the patients. And so far we have been trying several programs I mean, starting because in Taiwan, we have a national board exam at the end of July. Okay, so the student, most of the graduating student, they finish their school maybe around May. So between May and July, the hospital design a very comprehensive educational courses for these graduating nurses to learn from in terms of their clinical skill, in terms of their clinical cognitive preparation. An important thing is how to collaborate in clinical work with other team members. These are the components we've been emphasized. And because we know that for those pandemic, we call this a pandemic nursing student, okay? They spend 3 hours, 3 years in pandemic. For this pandemic nursing student, they do need some additional support. And we do need them to have the confidence and also the full scale of the competency when they get into our clinical hospital. So that's what we've been doing to prepare the competency for entering to our clinical sites. Okay, yeah, that's what we doing additionally after the pandemic to prepare the pediatric nurses to have a ideal or optimal competency to meet the challenges of the clinical situation. Yes. Thank you so much.
Thank you. Any question, Mbak Yani? Tadi ada yang belum ya?
Ya, yang apa itu? Apa ya? Cara menghitung beban kerja ya. Tapi tadi udah ya, sedikit ya. Jadi, Prof. Shu, so new nurses are given accelerated education and training to become competent and able to able able to provide services to pediatric patient in acceleration in accelerating the increase to
Accelerating.
the accelerating the increase in the
Career.
newcomer ya of nurses.
Yeah.
New nurses.
New nurses, right?
New nurses.
Yeah. Yeah.
Percepatan ya maksudnya ya, accelerated.
Do you have accelerated program for new nurses?
Yes. Yes. Yes, we do offer the new additional intensive training program, or we say orientation program for our new nurses.
Okay,
And
thank you, Prof. Shu.
yeah, and we know that actually this is not a situation unique to Taiwan. From all the evidence, we have noticed that for the pandemic nursing student or pandemic medical student or pandemic the other student, they do need additional support from our facility to help them to bridging the school education into clinical practice, because the pandemic do have a great impact on their physical, psychological, and social well-being. And in particular, the way they communicate to people are different. I mean, because we are doing so many online, right? So they probably more don't have that much experience to interact, communicating with the peer. Yeah. And so we do need to offer them with some additional educational preparation.
Okay. Thank you, Prof.
Thank you.
Thank you, Prof. Yusu and Miss Yani. There's a question from Ayu. You read the chat?
Oh, let me read it. Give me a second. Oh, are you? Yeah, yeah. Oh, okay. Thank you, Ayu. Yes. From National Taiwan Nurse Association, we have different committee for different specialty. Okay, and for the mother and the baby, we always are good partner together, right? So we have the committee specifically for the mothers and infant. And what do we do in the committee is we need to planning a, a national level of the educational activity for our pediatric nurses and also for maternity nurses. Specifically for the pediatric nurse, we have offered a specialist tracking. I mean, they can getting a certificate or work as a pediatric specialist. So in the committee of under the Taiwan Nurse Association, we need to arrange the not the board exam, but the certification examination for all the pediatric nurse who are interested to be certified as a specialist. They need to attend the examination. Usually we offer this examination during the summertime. Okay, so this is one of the activity that we are doing. The other activity is we offer a workshop to our pediatric nurses. And during this workshop, they get to know the peers from other hospitals. So they can have some peer interaction across institution. In addition to the routine educational activity they just receive on their own facility. So usually we have some small workshop as well, very intensive one, including a small group of the pediatric nurses. So for the educational role, I mean, the committee need to advocating the educational activity. And also we do offer some research funding. If the nurses from the clinical practice, they do want to advance their evidence-based nursing by conducting a research, they can apply for the research funding from Taiwan Nurse Association as well. And the other thing is try to have some collaboration. Especially, we're looking forward to have some interaction and collaboration from the Pediatric Nurse Association from Indonesia, so we can have the international experience exchange, not just from the faculty alone. It's very important to the first line nurses, so they can learn from each other. So these are all the activities that we've been providing to our pediatric nurse in Taipei, in Taiwan. Thank you.
Thank you. Fitri, do you have any questions? Fitri, there are two Fitri here. You Fitriana from Riau and Fitri from Jakarta.
Excuse me, Bu Alen. Prof. Kuo, there is a question in chat room, please.
Yes. The question is that what is the career path, right?
Yeah.
Okay. All right. What is the career path of pediatric nursing in Taiwan? Okay, thank you. Right now in Taiwan, actually, to work as a pediatric, we have different career paths. Okay, if you up to work in a community, then we have over a lot of community health centers so you can work there. Most of the time they do the health promotion activity, okay? And the other service we can offer is acute care, which is most of the in the hospital. So they can choose to provide more acute care in the acute setting, okay? The other one is the path that we emphasize on the early rehabilitation facility. So it depends on the nurse's career planning. But we do encourage our new graduating nurse who getting more clinical experience from acute care first. So that way, if they further their career into the a clinic or a community health facility or into the rehabilitation facility, they will be able to know how to connecting these different stages of care, at least 2 years of acute care setting. Okay, and so in our career planning of pediatric nurse, they can study as a registered nurse. Okay, as I mentioned, we do have the clinical ladder for them from the first year, second year, and fourth year. Actually, it's not the year, it's N1, N2, N3. Maybe some people, they were up to pursue their N3 in their third year, or you can fulfill this N3 later in 5 years. It's okay. We don't want to push our pediatric nurse too much. We know that there are so many job demanding on the clinical practice. So everyone planning their clinical path as their own scenario, as their own situation. Okay, so this is the path for clinical practice. And some of the nurses, they can advance their pediatric care. I mean that they can get a nurse practitioner to get a certificate as a nurse practitioner. So that way, they're going to combine the role of nursing and also the autonomy clinical care, which means that they're going to, under the physician's supervision, to do some direct patient care. For example, prescription, arrange some examination, test, interpretation of some test results, and provide a service, the education to the patient and the family, which are under the scope of nurse practitioner. So up to the 4th year of nurse N4, they can choose whether they want to be a nurse practitioner or they can stay as their nurse role in the acute care setting or community care setting for our pediatric nurse. Yes, and I just want to mention that in Taiwan, the career path of N1, N2, N3, N4, this is analogy all Taiwan. So the nurses can change their hospital when they really need to do location. For example, maybe you got married, you need to switch to another city, but your status of N1 or N2 is going to be analogy by another hospital, because different hospitals, they follow the regulation and suggestion and also recommendation from our Taiwan Nurse Association. We all follow them and we acknowledge the evaluation procedure from Taiwan Nurse Association. So I think this is a good thing for our pediatric nurse. They can planning the continue the clinical care career path in different facility, and still it's not going to affecting their path. They still can pursue their career path. Yes, for the long-term goal. Yeah. Thank you so much.
Thank you. Yeah, Bill. Anna, maybe you have any questions? There's another question in chat room.
Yes, I saw it. Yeah. Because TMU has a program, clinical rotation traineeship for nursing student and for professional nurses. Oh, okay. Thank you so much for your questions. We do have we say cross training, cross training for our professional nurses. Okay, for example, but this cross training was in is very active before pandemic when we have a sufficient manpower. Okay, and during the shortage time, we would like to secure of the manpower and also the health professional in their own familiar world. Okay, so right now post pandemic, I think maybe we can initiating again, resuming again the rotation. Okay, actually the rotation only within the pediatric unit. Okay, we have pediatric ward and we have intensive care unit for pediatric. So they will do the cross training from the regular ward to the in special care unit, and also maybe from the nursery to baby cross training to the intensive care unit. And why they're doing this is they want to ensure the nurses knowing the 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 uh, the clinical practice across different units. So that way, we can bring in the children and the family experience while during their hospitalization. For example, maybe we have a premature infant, right? They need to stay in the NICU, a neonatal intensive care unit, and eventually they may move to the sick baby room or move to the transitional care unit and move to the nursery. So they would like those health professional nurses between these three units, they all know each other's clinical practice. So that is the part of the reason we initiate the rotation. Okay, and also for the student, yes, we do have a rotation for students. They need to learn all the specialty in different area before they can get the board exam. For our board exam, for every eligible student to attend the board exam, they need to have 1,040 hours of clinical hours, and which can include several specialty. They have been recommending a certain regulation for medical, surgical, and maternity, and also pediatric. And each student, nursing student, need to fulfill of these criteria. If they did not fulfill these criteria, then they will not be eligible for the board exam to become a professional student. Yes. Thank you so much.
Okay, thank you, Professor. So, in Indonesia, we have a clinical rotation for the students, and then nowadays our government asks our students to do it in abroad. So, for example, for the pediatric rotation, they can do it in abroad for for at least 1 month, and after that they can get a new knowledge and also can share the experience with the student in Indonesia, as well as for the nurses. That we know that nurse need more information, more practice, and more knowledge, and it can be easier to get when you are do internship in hospital abroad. So is it possible to do it in TMU? If it's possible, then we can arrange it for this year or next year.
Okay.
Yeah, Fitri asking for fellowship, something like that, yeah, for nurses in Indonesia to get some short
experience.
training or short practice in Taiwan.
Yes. Yeah. Thank you so much for your questions. Yes. I think there is a possibility we can do this exchange and collaboration, and for the accepting the student for the internship from the international, I mean the country outside of the Taiwan. I think there is there is a chance. It's just that we still did not have that many of these experience yet. And the most important thing is most of the patients in Taiwan, they speak Chinese. And it is kind of a language barrier is one thing to preventing the learning from the international student. Maybe we need to think about training in the situation is more comfortable for our international student or nurses to do this outbound internship. I think the major obstacle that we need to overcome is the language setting of the hospital. If we have a specific unit, we're taking the international patient, and we do have, our hospital passed the joint commission evaluation. It means that we can taking care of the international patient. So that way, if the English is the language, I think there will be no problem for our international student or health professional to do the internship in Taipei. But anyway, in TMU, we do receive the international student from different country. And we do arrange them to go to hospital for the internship. But as long as they think that internship can be just a planning as observation and also not direct patient care, I think it is workable. I mean, it's just like a shadowing, the shadowing of the nurse in Taiwan. So that way, maybe the nurse, international student, they don't have to directly every minute to do the direct communication for the patient and give out the medication and do all the procedure. But instead of they do the shadowing of the nurse roles in Taiwan or in our hospital. I think we have plenty of experience like this. It is very workable. Thank you.
Thank you.
Okay, thank you.
And I'm really wonder, is it possible to do our professional nurses from neonatology unit to do internship in your hospital in TMU?
Yes, thank you for your question. I think as long as you feel that to do the shadowing is okay with your learning or your activity goal, I think this will be workable as well.
Yeah.
Yes.
Okay.
I mean, when I emphasize shadowing is maybe they are not going to provide a direct care, but they can participate, observe the care that we are being provided to the patient. Then I think this should be an opportunity to do the further planning.
Yeah, thank you. This is interesting.
Thank you.
Thank you.
There's another questions in chat room.
Yes, staffing in a pediatric unit.
Staffing.
Oh, formula. Okay. Thank you so much. Usually, I mean, in the what kind of unit? Let me see. Pediatric unit. Okay. Let's say in a pediatric ward. Okay, because this is different. For the intensive care unit, for NICU or PICU, pediatric intensive care unit or neonatal intensive care unit, I think the ratio of the nurse and the patient is very different from the ward, right? So for the NICU or PQ, I think it's 1:2 ratio for the staffing, okay?
Yeah.
And for the pediatric ward, during the day shift, evening, night shift, we have different nurse and patient ratio. It's a range, I mean, for the day shift, it's range from 5 to 6, 5 to 7 per nurse during the day shift, and then evening shift will be go higher, and then maybe I really need to give you exactly the number. Maybe I just give you roughly for this time, okay? Please come to visit us hospital, okay? So I can give you exactly the number when you come to TMUH. And the evening shift will be a little bit higher, maybe 9 to 10, okay? And the night shift from the 12 to 8, the number will go higher, maybe 12 to 15, something like this. Yeah, but anyway, if we didn't have that pediatric floor on the patient, we still keep the minimum of the nurse staffing on board. Yes, because we never know who are we going to get a new patient in the meeting. We maintain a minimum bar for each shift. It's just that during the day shift, we have a lot of procedure to be offered to our patient, a lot of discharge education, and also most of the admission was occurring during the day shift or early evening shift. So during this busy time zone, we provide more higher number of nurses in our the schedule to taking care of the patient and also be able to complete their task within the time. Yes. Thank you so much. I really looking forward you come to visit us in Taipei, okay, in near future.
Very much.
Thank you, Prof.
Thank you.
Ya, ditunggu tuh.
Iya tuh.
Taipei.
Sama Bu Alen ya, Bu.
I will go there.
Okay. Imelda, do you have any questions? Rusana, boleh chat room Pak Jupri. Ana, mau ngomong?
Jadi grogi. Can be IPANI or Nation Pediatric Indonesia. Can we have opportunity to visit TMU?
Of course. You are all very highly welcome. And as I mentioned, we have 3 affiliating hospitals with Taipei Medical University, and which the 3 hospitals is in different area. Some is in the urban and some in the new Taipei city, and they all have their own different features of care. For example, in TMUH, we are so emphasized on those technology care. I mean, we have receiving a lot of patients. They have intensive care on the some technology assisted procedure in our hospital. So yes, please accept our warm welcome. Okay, please come to visit us at Taipei, and then we can arrange the visiting in our 3 affiliated hospitals. Thank you
for the invitation.
And we hope that we have the mutual visitation in your in Indonesia as well in the future. Yes.
Yeah.
Yeah. Thank you.
Okay, thank you. Yeah.
Sorry, Bu Alen, can I have ask a question?
Yeah, of course. Yeah, this is from Fauzia.
I want to ask about the continuing education in for the nurses. Is there held regularly or is a must for the nurse who have works for a couple years? Is there any a must for doing a continuing education?
Requirement ya, requirement
Yes.
maksudnya. Yeah.
Okay, thank you. Thank you for your questions. For our registered nurse license to be able to renew, we do have the criteria. You need to complete it the certain hour of the in-service in order to renew our registered nurse license. Okay, this is one of the regulation. And the second regulation is implemented by different hospital. They do have a regulation for the each nurse to fulfill. For example, they probably say every nurse, you have to move to the N1 or N2 within certain years, okay? Or actually they provide the incentive as well. When they move from N1 to N2, they put down a little bit difference in their salary. So they will provide them with some incentive. They need to move upward. Okay, and we, as we mentioned earlier, each hospital, they do follow the core component issued by Taiwan Nurse Association in terms of in-service education or continue education. So for each later of the nurses, they need to complete a certain courses, and which courses is offered from each hospital and also offered from the Taiwan Nurse Association using online method. We have so many online courses. As we all know that nurse is the professional, work so hard, right? And we are so occupied with the job arrangement. Probably you don't have additional time to attend certain courses. So we make several courses online. So they can go the platform and to getting the credit when they have available time. Yes, so yes, we do have the specific regulation of the core course for each different layer of the nurse to be followed. So that way we will encourage them to further their continue education. And as they move on their career in the nursing care in Taipei. Yes.
Okay, thank you, Prof. Shu.
Thank you. Thank you so much. I saw a question in our chat room. Okay. We do have the competency standard for registered nurse. It means a general nurse, okay? And we do have a competency standard for a specialist. We have the specialty later 1, 2, 3 as well. So for them to moving on to from 1 to 3. So, and this standard is being acknowledged by the we do have a association specifically for nurse practitioner, and also the association specific for the registered nurse, which is the general nurse. And those curriculum, those standard is being established, very well established and being implemented by different facilities. Thank you. What is the role of health professional? Okay. When we thank you for your questions. What is the role of professional organization to the health regulation? Okay. Thank you for your questions. I'm so proud to share with you a good news is right now the leaders of Taiwan Nurse Association, Professor Chen, she also is a legislator in our government. So this is the first time we as a nurse professional can be voiced out in legislators and to participate in several policy or lawmaker in terms of health regulation. And actually, our leaders, she really voiced out for our nurse as a whole to help. It's whole for our health regulation in terms for the patient, in terms for the nurse professional can be heard by the lawmaker and can be heard by the government. And in order to put more resources into our nurse development, nurse professional development. And actually, it is so true that during the pandemic, our government really acknowledged the contribution from a nurse professional. So for those nurses who work in a special care unit during the pandemic, they really they do receive the reimbursement from the government for acknowledging their contribution. So this is very specific in one of the example how the health organization can be seen by the public, can be heard by the government, and then we can direct or indirect impact on the health regulations. Thank you. I believe that we do have the similar efforts from health organization in Indonesia, right? And we do this impact for the nurses as well. Yeah. Thank you so much for your questions.
Thank you very much.
Thank you.
Any questions? May we know that how many nurses around Taipei? How many?
Oh, a lot. Okay, in Taipei, it is very concentrated of hospital in Taipei City. Because we have a lot of residents in Taipei as well, and we have all the medical center and the resources. It's very concentrated in Taipei. So I couldn't give you the exact number, but in Taipei, it's a high number among the national of the nurses in Taipei. So again, I do invite our participant or our head for today. Please visit our Taipei Nurse Association in the near future, so then we can share with you with more detailed number of the how we run the nurse association, how many nurses that we have. And actually for the nurse association, they do so much for the nurses. They try to build up a community support from the nurse association for the nurses. Yes.
Okay. Thank you. And I heard you mention about many immigrants comes up to now.
Taiwan.
Yeah, to Taiwan. They're working or study or?
We have all different kind of immigrant for different reasons who immigrant to Taipei or Taiwan. For example, I have a student from Indonesia, and she come to our school for the study, and then she find out she's pregnant. So then she will wait till the certain period of time they can get the benefit from the insurance coverage, and also she received the care in our healthcare system. Okay, so some of them are students. Yes, it's true. And some of them are the worker. Yes. And some of them maybe is the short visit. And most of them is permanent resident in Taiwan. Yeah. So right now in Taiwan, we do have addressed their health concerns. And in specifically, as I mentioned, we have the children book, right? And we also have the mother's health booklet as well. So right now in this government made the health booklet, we all made it in different languages. We have Indonesian version, Vietnam version, and all kind of the cultural background. We try to address their specific cultural concerns into our booklet. So if the mother of children is from different country, they can take the version, so they can go through the immunization schedule when they have to meet the physician at the facility. And in addition to the written booklet, we also make them in as online material, so people easily can get access to the online material. In addition to this, actually we have an organization that taking care of the immigrant. They want to ensure their living, and also living arrangement and health care, and also the employment, and also the other activity is being well supported. So they provide different resources for our new immigrant. For example, they have a specific protocol. If you come to Taiwan as a resident, and you need to have the step 1, 2, 3 to be followed, and they will guide you and refer you to a nearby a cultural support group, so that way you can be connected and be able to know the resources nearby your neighborhood. Yes. Yeah, this is the trend for our healthcare in Taiwan in general, to address targeting the healthcare need of new immigrants. Thank you.
Yeah, that's interesting. Okay, that's 14 past 15, 16. Yeah. 16
Yes.
past.
Time flies.
Yeah. We enjoy for discussions.
Yeah, same here. I really enjoy and learn so much from all of you today.
Yeah. And I think from Indonesia Pediatric Nurses Association, we'll plan to visit TMU and meet Professor Shu Yu there. Yeah.
Good.
And make a visit for 2-3 hospital to find out and discuss with nurses, especially pediatric nurses there. Talk about the experience, the educations, the career path, something like that. Because in Indonesia we are regional structure for Indonesia pediatric nurses, because we have 34 provinces.
Oh, yes,
Provinces around
large.
Indonesia. Yeah, very large.
Yeah, okay.
So, as a Center for Indonesia Pediatric Nurses Association, we have to build and empower our member, as well as the apa tadi, the district IPNA.
Yes.
Right now we have 18 district for IPNA, but we moved to 34.
Oh,
double.
Wow. Okay. Yeah. We have an enormous target population to be covered, right? From the pediatric Nurse Association. Yeah, we all know that it's so important to have an event for pediatric health, right? This is very so important for the
because we grow the generations, right?
Yes,
Yeah, the healthy generations.
Yes.
And children's born until 18 years old, almost 30% of Indonesian population. So
okay.
So it means very big population to take care.
Serve. Yes. Very important.
Ya. Oke, kalau tidak ada lagi? Cukup ya untuk pendahuluan. Ya. Thank you very much, Prof. Shu Yu, for the times and the sharing experience today with us, and have Ibu Fitri for international collaborations here will develop the visits maybe next year, and bring some nurses there. Okay, thank you very much.
Thank you.
Kita foto dulu ya. Foto. Take a picture, please. Tolong yang belum buka video. Bu Lita, Pak Jupri, Bu Yani, Bu Imelda. Ayo. Pakai handphone, nggak apa-apa, buka aja. Oh ya, ada link absen tolong diisi dulu sebelum live ya. Pak Jupri, Bu Yani, Imelda, udah live ya? Udah lagi sibuk. Oke. Mbak Fitri, boleh dibantu? Kita kasih reaction ya. Kasih heart buat Prof. Shu Yu. Ya. 1, 2, 3.
Oke, sudah.
Oke, terima kasih. Thank you very much, Prof. Shu Yu. Thank you very much for friends.
Thank you, Prof. Shu Yu.
Yeah.
Valen.